Hi, my name is Dr. Priya Batra. I'm an OBGYN physician, and I'm Senior Medical Director for Family and Community Health at Inland Empire Health Plan, or IEHP. We're a Medi-Cal nonprofit health plan for members that live in Riverside and San Bernardino counties.
Well, we're going to jump right into it and talk a little bit about the effects of COVID-19 on our region. And if you could share with me some of the things you're telling people in the community of how to deal with the effects of and the result of COVID-19.
So I think IEHP is actually providing support for community around COVID-19 in a couple of ways. First, obviously, we're a health plan, and so we cover all the testing and care needed for those affected by COVID-19 or who are worried about being exposed. And so for that perspective, I think the health perspective, we really recommend following public health guidelines, social distancing, and getting tested if you're concerned about symptoms or if you've been in contact with someone else who is. So obviously we support that. I think what else is a little interesting is that we're also supporting a lot of the social needs and sort of the stress and anxiety that comes up around COVID-19. For example, IEHP has been doing a lot around getting food and other resources to folks whose jobs may have been affected by COVID-19 or who are isolating and really shouldn't be leaving the house and need help with those things as well. And as far as sort of stress, there's a lot of anxiety, I think, related to COVID-19, not knowing where to go out. People may feel isolated from their traditional support. So if you're not supposed to be physically around your support network of friends and family, how do you really deal with that? And so along those lines, IEHP is actually providing a lot of our courses and support groups and health education programs virtually so people can connect that way. And additionally, we, as always, cover mental health and behavioral health services to help get you through this time where you may be feeling more anxiety.
I only want to spend a little bit of time on this, but the mask, no mask, we live in the Inland Empire, it's hot, we're used to being outside, we're a very active community. Can you give me a little advice or insights of how I should interact with my family members and friends?
That's a great question. And as someone who's also trying to wear a mask, it is really hard in the summer, right, in Southern California to feel comfortable doing that. So I totally relate. I still think it is important when we're out and about doing things like shopping, areas where we're putting our essential workers at risk to wear a mask. Also, unfortunately, when we're outside for now. But I think the other thing to point out about being outside is that it's actually one of the safest places to be right now if you want to socially, responsibly hang out with your family and friends. So things like hiking, going to the beach, now that it's getting hotter, can be safe as long as you maintain distance and do wear a mask when you're close to folks. But, I think it is uncomfortable. We know it's difficult and challenging right now, but it's one of the best protections we have around COVID at this time.
So you're telling me that adult softball is socially responsible because we can do social distancing?
I mean, those types of technical questions, you'll really have to look to your public health guidelines or your public health agency for guidance on. I know that's a tough one. So as far as like sports that are more safe, I think running and biking solo or in a group where you are isolating with that group is a great idea right now. Hiking in groups that you're isolating with, like your friends and family, I think is a great idea. Team sports, I think we're going to have to wait to get more public health guidance on that specifically.
You're killing me, doctor. You're just killing me.
I don't know if you saw that in places where they are resuming team sports, what comes to mind is South Korea. They actually brought back baseball games, but in the stands, they don't have any spectators. They have stuffed animals. I don't know if you've seen those pictures online, but I think that's a creative way of getting the game.
I'm being selfish now because I play adult softball with the guys, and nobody comes out and watches our games anyway, so we'll never have a problem when it comes to
you're safe and ready to go, it sounds like.
On a more serious subject, we are doing this for our Latina conference, and of course we appreciate the support of IEHP, but talk a little bit about women's issues, women's health issues. We talked earlier about the fact that women, more often in my culture, the Latin culture, that they take care of everybody else in the household before they start taking care of themselves. So share a little insights of what we can do as a family unit to encourage the women in our lives to take better care of themselves.
Thank you so much for pointing that out. I think that is really true. We say that honestly, women are the healthcare managers often of the household. And so they do tend to do organizing for health services around children, around their partners, other older family members that they may serve as the caregiver for. But I think the point that you made is really important, that women need to take care of their own health. And it's sort of that saying of when you're on an airplane, in the safety announcement, put your own mask on before you help someone next to you, right, with their oxygen mask. So you have to be in the best shape you can be in to take care of those around you. And I think specific to COVID, especially, something that we are really concerned about at IEHP is that women may be putting off health screenings and things like that, preventive care around breast cancer screening, cervical cancer screening, managing any conditions they may have because of COVID. And so I think now is the time to really explore with your provider, if you are a woman who has any of these concerns or issues, to see if you can get back in for that care.
I want to leave with our final question, something that's concerning me and many of the colleagues that I talk to on the phone, and that is mental health. I mean, we've been isolated for a long time. We're still trying to do social distancing, which means we're doing a lot of these video conferencing calls. I don't know that closing the doors, the walls closing in on us, reducing stress is probably a major thing that we should be thinking about. Any suggestions, any insights of how to deal with reducing stress in the time of COVID-19?
It's a huge issue. It's a really huge issue. And I think we're feeling a lot of uncertainty and anxiety. So a couple of things I can recommend. One, it's important to, when you feel that these sort of stressors are getting the best of you, to reach out for help. So IEHP, for example, we cover therapy, any type of mental health services, even just to sort of try it out for now. So that's always an option. Additionally, on our website and through our community resource centers, we're offering to anyone in the community, not just our members, podcasts and sessions you can online where you can learn how to meditate and breathe and relax. And there are actually tools that can help with this anxiety. It's not necessarily that folks are maybe suffering from depression or anxiety, but there's a lot of stress in this current time. And so we call it resilience, sort of building those coping skills that can help you deal with stress, not just from COVID-19, but also day-to-day stress with work and family. So those are resources I would recommend.
One of the things we really didn't talk about is telemedicine and how that's going, and IEHP's involvement with that. So your final thoughts, and then talk a little bit about telemedicine.
Telemedicine, I think, is a great resource. It's covered by IEHP. So if your provider offers telemedicine, you can definitely get those services. I think that what's been really interesting is that during COVID, obviously, telemedicine has really exploded in use and interest, both among providers and our members. So we are continuing to support that. And I think that telemedicine, going back to your earlier question about stress, I think telemedicine is actually great for counseling and therapy and those types of services, because it really lends itself well to this type of connection, sort of similar to what we're doing now, actually. So that's a really great point. And then just in terms of closing thoughts, I think, at IEHP, we're really trying to serve the health needs and also understand a lot of the social needs and the uncertainty that's coming with COVID-19. And so we're going to continue to provide support and resources in those areas.
Again, Doctor, thank you for your time. And I appreciate your support and your insights on these topics.
Thank you so much for having us. And I am really honored, IEHP is really honored to be included in this conference. Thank you.